Hey, I'm Edward Page and I'm 9 years old.
Edward is our rising fourth grader. He loves everything nature related. He loves animals. He loves plants. He knows more plant names and their scientific names than I do.
Yeah, if you came across Edward on the soccer field or at school, you'd think he was just your regular 9-year-old boy who just likes to play soccer and likes to do silly things. So Edward was 4 at the time, and my wife was out of town, and I took him to his regular soccer game on a Saturday morning, just like many other 4-year-olds, and he just didn't look right. He'd been complaining of some pain. He'd been losing a little bit of weight, and he just didn't look himself, and he literally sat down in the middle of the soccer field, and I knew something wasn't right. So I took him to the pediatrician. The pediatrician said, "You should go to the emergency room." We went to the emergency room, and that's when, unfortunately, he was diagnosed with metastatic neuroblastoma.
Neuroblastoma is a tumor that was in his abdomen that was wrapping around a lot of his major blood vessels and his organs. It had spread to his spine and his chest, and at the time of diagnosis, it was pretty far advanced. What we found out pretty quickly into the diagnosis was that the treatment course was pretty long also. Just getting through the normal phases of treatment was about 1.5 years. We knew it was going to be a long road ahead.
I'm a surgical oncologist. It means that I take care of tumors like Edward's, but in adults. And even though I spend probably 50% of my day looking at imaging, like CT scans and x-rays of tumors, they asked me if I wanted to see his, and it was too close, too personal, and I couldn't look at his.
After that first set of low-dose chemo, he went into the high-dose chemo where it really wipes you out and you have barely an immune system left behind. Actually, no immune system.
One of the things that we have been so happy about it as pediatric oncologists over the last few decades is seeing the increase that we have in cure rates for children with cancer. However, that comes at a cost, and the cost that we face is about 2/3 of the patients that we treat have some side effects from the therapy that we give.
Not everyone makes it through that process. It's a really difficult treatment. And so to watch your child go through that when they're 4 or 5 years old is devastating. But we always told him, tomorrow will be better. It will get better tomorrow. Within 6 months of us finishing that protocol, he was found to have another spot in his chest. And we had a decision to make at that point.
Edward was initially my patient and just a phenomenal kid with high-risk neuroblastoma. He had a great response to his upfront therapy, but unfortunately his tumor did recur. Relapse neuroblastoma is very difficult to treat and doesn't have a lot of options for curative therapy after relapse. But we are able sometimes to offer them therapies that are somewhat tumor targeted, but not specifically to a tumor-specific mutation.
Precision medicine is the idea that we would like heading towards the goal of having much less toxic but more effective therapy for all children and adolescents and young adults with cancer. Through the precision medicine program, sometimes we can identify a gene that goes awry and be able to have a drug that turns that gene off and is able to then allow the cancer cell to be effectively treated with the chemotherapy drugs that we're given.
In Edward's case, we sent off his tumor through our Aflac Precision Medicine program and identified an ALK mutation. So ALK gene has been found in a subset of neuroblastomas to be mutated and thus targetable with different ALK inhibitors. He was placed on the lorlatinib therapy, which is an ALK inhibitor, and has really had no evidence of disease for many years.
That's why we're so grateful for precision medicine, honestly, because it gives us that extra tool in our tool belt to really fight and keep this very high-risk cancer from coming back. Cure has been with us every step of the way, from meals in the hospital to holiday retreats to just a reprieve at any time, to all the way the most significant, helping us treat Edward and keep his cancer from coming back. I feel comfortable saying that without having every skill, every tool, every asset available to us, which we needed to cure Edward, we would not have that without Cure's support.
5 years ago, we launched the Aflac Precision Medicine Program, really with the assistance of Cure. And if it weren't for Cure, this program would have never been launched.
You know, I think Cure's funding of the Aflac Precision Medicine Program has made an impact not just here, but to patients outside of Georgia in many ways. And one of those ways is we have learned a lot from our 200 plus patients that have been sequenced. And a lot of the information that we've learned has allowed us to create novel treatments and novel trials, not just locally, but nationally and honestly internationally.
About 80% of the patients that we care for, there has been a clinical benefit to having the precision medicine program. So in the absence of that, we would have patients not getting the very best therapy. We might miss out on treatments that we could offer families, and we would not be giving the best clinical care in the absence of the Cure funding.
Almost 5 years ago when we were first diagnosed, these options were not available. To have this medication that could keep us out of the hospital has just been so invaluable to us.
Now that we have weekends where we can go to soccer, go work in D-Weed as garden and have violin lessons, we don't take any of those for granted.
I love that he's healthy enough and strong and thriving enough for me to be able to fuss at him without feeling guilty about it. That I can treat him like a normal 9-year-old. I love it.